Thank you, Mr. Speaker. As co-chair of the Bipartisan Rural Health Caucus, I'm proud to lead my colleagues today in celebrating Rural Health Month. With 61 million people, roughly 20% of the United States population, living across 97% of the country's landmass, delivering health care to every corner of America has required unique and innovative approaches and remains an ongoing challenge. As the primary growers and producers of the food, fuel, and fiber that keeps our country running, rural Americans are also quickly becoming older and more ethnically diverse. Dealing with the challenges of keeping up with the world increasingly dependent on broadband activity support all aspects of life, including health care delivery, can be a challenge. Since 2011, National Rural Health Day has been recognized annually on the third Thursday of November, coming up soon on November 21st. To highlight the dedication of healthcare providers and communities in addressing the healthcare needs of rural Americans. But for those of us representing rural and remote parts of this country, every day is Rural Health Day, as we fight to provide access to even the most basic care services and to work to improve health outcomes and the life expectancy of our constituents. Coming out of the pandemic, the health workforce shortage crisis in the U.S. remains one of the greatest challenges to healthcare, and we must take immediate transformational action to address it. Increasing the number of healthcare professionals is critical to expanding access to care in rural areas and keeping rural hospitals and clinics open, just as my colleague was talking about. One way to address this issue is by ensuring providers are adequately compensated for their services. The Medicare physician fee schedule is fundamentally broken. The Medicare payment rates have fallen by 29% over the last 2 decades, while the cost of running a practice is estimated to have increased by 3.6%. We need longer-term solutions that provide greater stability and certainty to our clinicians. Congress must pass legislation to stabilize Medicare physician pay so that doctors receive adequate reimbursement to cover the actual cost of providing care, especially in areas of rural America where these costs are higher. For doctors in my district, I'm also advocating for increasing geographic adjustments to ensure provider pay more accurately reflects the uniquely higher cost of healthcare delivery in remote areas like Hawaii. That's why I'm introducing the Protecting Access to Care in Hawaii, or the PATCH Act, which would provide a roughly 24% increase in Medicare physician payments to Hawaii physicians so that they receive a similar boost to their counterparts in other remote states like Alaska. For family physicians like Dr. Michelle Mitchell, higher reimbursements could have made the difference with helping her keep her practice in Hawaii and serving the community she cared for and loved. From 2008 to 2021, Dr. Mitchell owned Hawaii Family Health in Hilo, Hawaii, where she provided primary care services and offered specialty service like nutrition intervention and behavioral health to meet the needs of her patients. However, at the end of the day, after covering her overhead, including paying staff, utilities, and rent, she would only bring home enough money to qualify for food stamps. But she persisted. In an effort to lift herself out of poverty, she started conducting telemedicine visits for patients on the continent where reimbursements were much higher, but this was not sustainable. In the midst of the pandemic, she left Hawaii and moved to Kansas, where she could have a more sustainable practice, leaving behind patients who have struggled to find a new doctor to care for them. In rural places like Hawaii, we lose too many good doctors and, as a result, too many loved ones who can't get the care they need to survive. Nationally, the United States is facing a shortage of 40,000 to 60,000 physicians, and this shortage is expected to grow to 139,000 physicians by the year 2033. In my home state alone, the shortage of physicians is 757 statewide, and this is only expected to get worse. Over the past year, we've had 42 physicians retire, 4 have passed away, 55 moved away, and 212 decreased their work. Over 22%, nearly a quarter of our physicians are already over the age of 65, meaning they should be retiring soon, will be retiring soon, but the sad reality is that they can't because there are too many lives literally at stake to lose even just one more doctor in Hawaii. Unfortunately, given the low physician reimbursement levels in Hawaii, along with the high cost of living, and limited affordable housing options, it remains a challenge just to recruit and retain new physicians to our state and encourage our own quite frankly, our children, our kiki, to join the profession too. And that's why it's so vital we fix physician payment models for rural places like Hawaii, and we really make sure that we support our rural and rural communities throughout this great country. For my constituents on the island of Lanai, they say it's difficult to be born and to die in the place that they call home, in the place that they love. And that's because of their inability to see the appropriate provider and get the care that they need for their health. So I look forward to working with my colleagues to finally fix our nation's broken Medicare payment system. When we give our doctors a fighting chance to serve, we give their patients, our constituents, a better chance to live and to thrive. To continue now my long to-do list for Congress that needs to get done by the end of the year for our rural and remote Americans to make sure that they have the health care that they need. Number 3, we need to fund the government for fiscal year 2025. The House and Senate appropriation bills contain roughly $730 million for grant programs and initiatives that directly address the growing health care crisis in rural America. Rural health discretionary spending is vitally important for preserving and improving access to care for individuals living in rural America. This funding includes resources to support rural hospital cybersecurity, including funding to help small rural hospitals purchase health IT and equipment and address the growing threats on digital patient records. We read about this every single day in the newspaper. They need the support to be able to safely maintain both our health records and take care of their patients. This funding also includes funding for community health interventions, including to address the various crises facing rural America in maternal health, as we have just heard from our colleague, opioid abuse, and mental health. That's why I will keep fighting to ensure we pass a final spending bill that preserves increased funding for rural health care programs. Lastly, number 4, Congress needs to pass a disaster aid package. Earlier this week, President Biden submitted a request to Speaker Johnson on urgently needing funding to support the federal response to Hurricanes Helene and Milton and other natural disasters, including the August 2023 wildfires on my island of Maui. Over the past year, rural communities in the United States have been inundated by several natural disasters, including 17 storm events, 4 tropical cyclones, 1 wildfire event, and 2 winter storms. In June, New Mexico faced 2 major wildfires, and Iowa experienced record flooding from the Big Sioux River, which caused mudslides, washed away roads, and required evacuations. In September, Hurricane Helene caused catastrophic flooding, power outage, and property destruction in North Carolina. Rural communities are on the front lines of natural disasters, which can have far-reaching effects on health and well-being in the immediate aftermath, and in the long term, generationally, it has impacts and trauma that is felt. Damage to infrastructure caused by storms can compromise emergency response efforts, limit access to basic needs, and disrupt access to necessary health care and prescription medication. Storms can also have long-lasting mental health impacts. That's why it's critical Congress pass a disaster supplemental package this year. The President's disaster aid request includes a total of $2.7 billion for the Department of Health and Human Services, of which $260 million would be used to support health center infrastructure and ensure continued access to high-quality health care services in impacted areas. This funding request also includes $244 million to expand substance use and mental health prevention and treatment services, and $159 million to restore services needed by people with disabilities and older adults. Across the country, natural disasters have devastated communities, homes, farms, and businesses, and disproportionately impacted rural America, which is why I am urging all of my colleagues to support a disaster aid package that addresses both the immediate and long-term needs of impacted rural Americans. Okay, Mr. Speaker, today you've heard from our colleagues on both sides of the aisle. The Bipartisan Rural Health Congress, now entering its 2nd year and proudly going into its 2nd Congress, having been restarted by myself and Representative Harshbarger, proudly boasts 64 members on both sides of the aisle and quickly growing. In closing, I want to reiterate our shared commitment to ensure rural health remains a priority as we wrap up this 118th Congress and we head towards the 119th Congress in January. We will continue working with our colleagues to ensure that we finish our to-do list for rural healthcare this year, continue our bipartisan work in the years ahead, and make sure that every member of this Congress understands the plight, the need, the challenges, but yes, the opportunity and the hopes of rural America. Together, we can and must ensure everyone, regardless of where they live, how much money they have, or their life circumstances, has access to high-quality, affordable, life-saving health care. Thank you, Mr. Speaker, and with that, I yield back.